In this module, we'll be talking about the many faces of vegetarian. The different types of vegetarian diets, including the flexitarian, the pescatarian, the lacto-ovo, the vegan, and the raw vegan. We'll look at the health benefits and the potential risks, including common nutrient deficiencies, and then end, as always, with practical takeaways. So what is the prevalence? How popular is the vegetarian diet today? According to a 2019 Gallup poll, 5% of Americans are eating vegetarian. Now why? What are the most common causes and reasons for going vegetarian? Health benefits, ecological sustainability, which means we're doing less harm to the environment, the concern of humane treatment of animals, and for religious purposes. Let's look at the different types of vegetarian diets, starting with the flexitarian. With the flexitarian way of eating, it's primarily plant-based, but there will be occasional use of animal proteins. So they might have beef or pork or poultry or fish on an occasional basis. A pescatarian is plant-based, no animal flesh with the exception of fish or seafood. Lacto-ovo can be combined, which is the most common form of vegetarian, so a lacto-ovo, or they might just be lacto, or they may just be ovo. So what does that mean? Lacto means they eat only dairy as their animal sourced foods, and ovo means they only eat eggs as their animal sourced foods. So there's no animal flesh. This is really just products that come from a live animal. So your dairy and your eggs. There's also vegan. So this is no products are coming from animals. So they consume no animal-based foods, and that includes things like honey and beeswax, gelatin, animal broth, and animal byproducts. So that's a little bit trickier because you have to really dig into the ingredients to see if that product has any of those ingredients. Now, vegans oftentimes also avoid using products coming from animals. So this may be the use of silk or leather or wool, and even in supplements, they are looking specifically at the ingredients. So for the example of a fish oil, which typically is going to come from fish, so an omega-3 fatty acid, they will use one that comes from algae. Then there's a raw vegan, so that's a subpopulation of the vegan diet, and this is the same as a vegan, with no foods being heated above 115. Now that's not so difficult because there's no animal protein, so the risk is a lot lower in regards to eating foods more on the raw versus cooked side of things. And so they are really advocating more of an unprocessed food intake. So now we're going to dive into the health benefits, but before we do, I have to give you a caveat. That's one of my favorite words, if you probably have figured that out by now. Is the health benefits are based on the vegetarian diets being done properly. So what does that mean? And I'll explain what it means not to be doing it properly in just a moment. So vegetarian diets done properly means the person is eating a lot of vegetables, fruits, legumes, nuts and seeds, and whole grains. And what they're not eating a lot of are processed refined grains, processed vegan foods, so things made from plant-based foods, trans fats, excess sugar, and alcohol. So if the diet is proper and we're really eating a whole food-based diet with the foods that we just mentioned on the previous slide, we get a lot of antioxidant support, which, remember, oxidative stress is at one of the core roots of dysfunction in the body and chronic disease. We produce a lot of free radicals in the body. So by eating a lot of plant-based foods that have lots of different colors, we're getting the antioxidants that can help neutralize that damage in our body. We get lots of fiber from plant-based foods. That supports our gastrointestinal tract, our lipid and blood sugar balance. Weight loss or lower BMI. That typically has been shown with shorter term studies of 18 weeks. And again, if it's done properly, you're eating more whole foods. You're eating foods that are high in the nutrients your body needs to function optimally. Not more of what we're going to be talking about in the next slide. So not a processed diet, but a whole foods diet. You will oftentimes see weight loss with that. Reduced blood sugar and risk for type 2 diabetes, again, if done properly. Reduced risk for cancer. Now this is going to be more based off of the fact that you're eating at least 7 servings of colorful vegetables and fruit each day. In fact, for cancer reduction, the research is showing a better effect with 9 to 11 servings a day. So we can't be eating 2 or 3 servings of vegetable and fruit a day and expect a reduced risk in cancer. We really need to bump up those vegetables and fruit. Breast cancer has been correlated with soy. So in regards to reducing our risk for cancer and recurrence of cancer, especially of the breast, soy intake, especially in its whole food fermented form of like a tofu or tempeh or miso, has shown great benefits. And the reason why is a strong source of plant estrogens known as phytoestrogens. So they are taking hold of the estrogen receptors in our body, blocking that from taking on the more toxic forms of what we're producing in our own body or what we're being absorbed from our environment, called those xenoestrogens. So prostate, breast, and colon cancers are also correlated with less red meat and less processed meats, which in a vegetarian diet, you typically are not getting that, with the exception of flexitarian, but that again is very occasional intake. Reduced cholesterol and LDL cholesterol. So now what's that caveat in regards to, are you doing it properly or not? In my practice, I have met a lot of carbitarians. So those are the folks deeming themselves as a vegetarian, but they are primarily only eating processed carbohydrate foods, very little plants in regards to vegetables and fruit and legumes and nuts and seeds. So that is a much different profile nutritionally, affecting our risk for oxidative stress, inflammation, and chronic disease. So they don't have very much fruit, vegetables, or whole grains coming in. Again, it's going to be more of our processed refined foods, higher in sugar and salt, possibly even trans fats. And then we have that risk. You know, you can go vegetarian, and there's a lot of packaged foods on the market that are geared towards a vegetarian market, but they're very processed. So things like burgers and hot dogs and chicken nuggets that are made from a plant-based source, whether it's soy or bean, are most of the typicals, even mushrooms. So there's a lot of options out there, but again, look at the label, look at the ingredients. There are some good brands out there that have very few ingredients. You can identify everything, but they can have a lot of additives and preservatives, GMOs, MSG, gluten. So just make sure you're checking the labels properly and efficiently so that you are getting what your body needs nutritionally. Now, what are the common nutrient deficiencies if we're not doing the vegetarian diet properly in regards to our nutrients? This is going to be more common in our vegans because there's so many different categories omitted from the diet. Poorly planned vegan diets or vegetarian diets, or calorically restricted diets. B12. So this is a vitamin that makes red blood cells, supports our energy, prevents anemia, supports nervous system functioning, homocysteine metabolism, and our DNA synthesis. It's only found in animal products. So if you are vegan, that's going to be a big risk. Supplements are also poorly absorbed. If you're picking up a product over the counter at a local pharmacy, more than likely it's going to be a synthetic form called cyanocobalamin. And if we have digestive function dysfunction, which most of us do, we may not process and utilize that efficiently and effectively. And so you want to look for methylcobalamin, which is going to be a more methylated form, which is activated, so our body can use that for the functions that I just mentioned. Plus, if we have a reduced hydrochloric acid status, which happens as we age, happens if we're on proton pump inhibitors for long periods of time, and for a variety of other reasons, we need that acidic environment in our stomach to help us absorb B12. So that's another reason why that might be low. Now, nutritional sources of B12 plant-based would be nutritional yeast and fermented soy. So those are two forms in a plant-based diet that could give us some B12, but again, might not be quite enough for all the functions that we need it for. Calcium. And this is going to be more on the vegan side of things, or maybe an ovo side of things, or pescatarian. This nutrient we need to build and maintain healthy bones and teeth. We need it for blood clotting, nerve transmission, muscle stimulation, and vitamin D metabolism. And this nutrient is more critical during our bone building years, and that's going to be in the mid to upper 20s. As we get beyond our 30s, our need for bone building is less. So now it's more about preventing the loss and helping to maintain our bone integrity. So plant-based, we can get calcium through things like green vegetables, tofu, and legumes. And then there's also calcium fortified products in the market. Things like juice, like an orange juice that's fortified with calcium, or cereals or milk products if you are a lacto-based vegetarian. The problem with those are they can be inflammatory or higher in sugar or processed carbohydrates, so not necessarily, again, the best caloric value for the nutrients that we're looking for. Vitamin D. So vitamin D is our pro-hormone in our body. It does so many things. It is a super nutrient. So it supports our bone health, our mood. It helps to lower inflammation. It helps to boost our cells' receptivity and sensitivity to insulin. You name it. Immunity is also important for vitamin D. So in this case, like for vitamin D supplements, they typically come from wool, so from a sheep. If you're vegan, there are options that use lichen. Lichen is a type of organism. It's like an algae. And you can also find vitamin D in fortified foods, but a lot of times they're going to be more dairy-based. Omega-3 fatty acids. So these are the essential fatty acids that our body cannot produce that help us lower inflammation. You're going to find this primarily in the diet through fatty fish. Now there are some plant sources like ground flaxseed, chia seed, hemp hearts, walnuts, but the plant-based form doesn't convert very effectively into the active components of omega-3 that help us lower inflammation, known as EPA and DHA. So that is one component. So we can certainly eat these foods, but we may need to supplement. And again, you can get omega-3s from an algae source that still have a pretty concentrated form of EPA and DHA, more predominantly your DHA. Seaweed and algae are also ways that you could get it in through your diet. And then there's protein. So again, depending on what type of plant-based diet or vegetarian diet you're following, we might be lower in protein. And in the case of plants, they tend to be more incomplete proteins, which means they don't contain all of the essential amino acids and the levels that our body needs to function. And so essential fatty acids, if you remember from the protein module, are those amino acids that our body cannot produce. So we need to get them in exogenously through our diet. There's going to be lower branch chain amino acids. So one of the branch chains, leucine, is specifically needed for recovery and exercise adaptation. So we do need these nutrients coming in. So we'll have to be a little more, we need to be more tuned in to what we are taking in or what we're willing to add into the diet to make sure we are getting sufficient amino acids. Higher protein options that have a better essential amino acid profile that come from plants would be pumpkin seeds or pumpkin seed butter, lentils and legumes, tempeh or tofu, and quinoa. Iron. Iron is needed to make our red blood cells, supports our energy, and prevents anemia. Now, animal products, just like B12, are our primary sources of iron. There are some plant-based sources of iron, such as legumes, whole grains, dark leafy grains, but also molasses, which I didn't mention on here. And these plant sources are not going to be as bioavailable at the cell as the iron coming from our animal proteins, which is called a heme iron. That's going to be best absorbed and utilized in the body. Non-heme iron is what's coming from our plant sources. Now, if you eat vitamin C along with these non-heme sources, you increase the bioavailability. And that can be through your diet, through citrus or bell peppers, or it could be a vitamin C supplement. along with your plant sources. So that can help. The other thing to think about is a lot of our plants have an anti-nutrient called phytates. So when we're eating a lot of plants and we're trying to get these specific nutrients in, they can actually bind them and prevent them from getting absorbed and used in the body. So another risk that we pose with the plant-based, so things that we need to be aware of and test for so we know how to best adjust our diet and or supplementation protocol. Zinc we need for cell growth and repair, our immune system, the formation of proteins, DNA stabilization, gene expression, and protein metabolism. This also comes primarily from animal products and dairy like cheese. There's a poorer absorption from our plant products. You can find zinc in things like whole grains, legumes, nuts, wheat germ, and nutritional yeast. But here we bring in the phytate, that anti-nutrient that can bind zinc and reduce its bioavailability and utilization in the body. If you soak, ferment, and or sprout these type of foods, so you can do that with grains, you can do that with legumes, you can even do that with nuts, you can break down that phytate layer. Now that can be a little extra work. There are some, I've seen some of these items on the store shelves more in your natural food stores, so more specialized stores would carry it, or you may be able to order it online as well. Otherwise, you would soak it overnight, and then the fermentation can take maybe a couple days depending on what the item is, or sprouting, same thing. So it's a process to go through, but a way that you can help to reduce that phytate layer so that you can absorb your nutrients more efficiently. And the last one being iodine. So iodine is going to be found in seaweed and seafood primarily. So depending on what type of vegetarian diet you're on, you might be just fine, provided that you are eating some type of seafood or fish 2 to 3 times a week, and you're incorporating some seaweed into your diet. And there's those seaweed snacks. That's an easy way to do it, or any type of sushi, but you got to be careful of the higher mercury fish that might be in there, as well as uncooked fish. So that's a whole nother topic. In regards to supplementation for vegetarian diets, a good, well-rounded foundational recommendation would be make sure to take a multivitamin mineral that has at least 150 micrograms of iodine. That's pretty standard for your high quality grade supplements. B12 coming from methylcobalamin versus cyanocobalamin. Your omega-3s, so depending on what type of vegetarian diet and what your needs are, you can get that from fish or algae. And vitamin D3 with K2. Same thing, so your typical, which would come from wool, depending if you're vegan, you can do more of the lichen-based vitamin D. So practical takeaways. When you're going vegetarian, focus on your colorful plants, whole-based foods, plants. So strive for that nutrient balance. Try to bring in some of those plant-based proteins so that you get your essential amino acids. We talked about some of the plants that have a better profile in regards to the essential amino acids versus relying on the refined processed foods and your vegetarian-based products that are out there that are very processed and refined. And then supplement as needed. So this may entail a visit to a functional nutritionist who can assess your nutritional intake, look at some labs, so to see where your levels are, know what your chronic conditions or your symptoms are to determine what makes the most sense, personalized wise, for you in regards to supplementation. So I hope that gave you a better look at each of the different types of vegetarian diets and the common nutrient risks, but also the great health benefits that come along with a vegetarian plant-based diet, as long as it's more coming from your whole foods, colorful fruits and vegetables and plants. So with that, I will leave you here and look forward to seeing you next time.